Well, good afternoon. I want to begin by thanking the City County Council for their swift action earlier this week to approve more than $76 million in programming to bolster our efforts to combat the COVID-19 pandemic and to assist those in our community who continue to face hardships as the city slowly reopens to a new normal. Thanks to their unanimous support, Marion County will see dramatic expansions in testing, in contact tracing capacity, particularly in communities of color that have been hardest hit by this disease. And whether it's through rent relief, whether it's through the millions in small business grants and loans, the partnership with food providers such as Gleaners or Second Helpings, or frankly, services for our neighbors who are experiencing homelessness, I am confident that the steps we are taking will help Indianapolis weather this storm and emerge stronger than before when we get to the other side. I also want to take a moment to highlight one specific program that was funded by the council on Monday. Our efforts to ensure that every Indianapolis resident has access to a free and high quality face covering mask. Already, our online portal has processed nearly 14,000 requests for free face coverings, and those will begin hitting mailboxes sometime in the next week. In addition, through partnerships with community organizations and other local partners, residents will be seeing opportunities across the county where they can pick up a free mask if they need one. Once again, if you would like to request a face covering for you or a member of your family, you can do so at indy.gov/masks. That's indy.gov/masks. But we're not stopping there. And that's why today I'm proud to announce that in response to conversations that we have had with local businesses, we will be making free window clings available that restaurants, offices, and other businesses can display to send the message that we are going to keep Indy open, but we will only do so if all of us do our part to wear a face covering. And this is what the window clings look like. Keep Indy open, wear a face mask. These window clings will be distributed through chambers of commerce, through merchants associations. But if you are an individual business owner who would like to request one directly, you can do so through your Mayor's Neighborhood Advocate, or MNA. You can find your MNA through the city's website, indy.gov/MNA. As always, I do want to thank Marion County families for their cooperation, for their commitment to safeguarding our most vulnerable residents. As I have said before, when you see somebody wear a mask, they aren't wearing it for themselves. They're wearing it for you. That commitment, a commitment to our neighbors' health as well as our own, is what is helping Indianapolis move through this crisis. So, again, my deepest thanks to Indianapolis residents taking precaution for the good of us all. Now, while I hope all of you take advantage of these great services and join us in these important public awareness campaigns, I'm guessing that that's not why you've tuned in this afternoon. This afternoon, I am very pleased to report that after reviewing our county's health data including a continued decline in hospitalizations. That we'll get into that more later. Dr. Caine and Marion County public health officials are now suggesting we proceed to stage 4 of the state's Back on Track plan, effective next Friday, June the 19th. So we will be moving as a community to stage 4 next Friday, just a little over a week from now, June 19th. Here is a quick rundown of what changes residents can expect in stage 4. Newly opening businesses include movie theaters and bowling alleys, as well as other cultural, entertainment, and tourism sites, including our museums and the zoo, all at 50% capacity. Additionally, retail stores and malls may open at full capacity with social distancing in effect. Dining room service, along with indoor worship services, may increase to 75% capacity. And of course, outdoor worship services are not capped at all. Bars and nightclubs may reopen at 50% capacity, and bar seating in restaurants may now reopen. Additionally, businesses in office buildings may resume at full capacity, though with special accommodations for at-risk employees. Restrictions at government buildings will be determined by those government entities. But for those that visit the city-county building, downtown Indianapolis, please be aware that face coverings will be required. As city and county offices reopen, we will have some of our new masks available at the front door for those who may need one. And then finally, outside of the above restrictions, residents are still strongly encouraged to utilize face coverings and practice social distancing in their daily life. Now, with more on what to expect in phase 4, I'd like to hand it off to my partner, the director of the Marion County Public Health Department, Dr. Virginia Caine. Doctor?
Thank you. Thank you. Do I get this? Change presenter, yes. So first of all, let me just compliment you, Mayor Hogsett, and all of our expert panel advisors in making the decisions based on the science. It's been so incredible, the fact that we really look at the evidence before we make our decisions. And I also want to reiterate what you said, Mayor, and that is our progress has occurred because the Marion County community has been following the preventative measures that we need in order to safeguard ourselves, our loved ones, our colleagues, and our friends. And that's by doing the right thing, of doing the social distancing, wearing those face coverings when you need to, and frequently disinfecting those type of surfaces that may lead us to transmit infections. So I'm in my update here. We have had so far a total of 10,464 cases in Marion County. Our death rate has been 634, and we've tested a total of 62,803. But let me say this. We are now seeing 22 states across the country where their cases have started to rise. And in some places, it has been off the charts, where one state had over 2,500 cases occur in one day as a result of the reopening. So I just have to reemphasize, Mayor, that I've appreciated working with you and knowing that you're following the scientific evidence as we have made these decisions. So when we look at our trends now in Marion County to show how our stay in shelter at home has paid off, okay, and everything doing what they needed to do to curtail this infection, you will see by this slide, when we look at our new COVID-19 cases that are occurring per day, we have been starting to see a significant decline in our cases all the way through to June the 3rd. So we're definitely going in the right direction significantly. When we look at our emergency room visits for patients who have symptoms for COVID-19, not the symptoms of the flu, but symptoms of COVID-19, and there are about 8 or 9 of those symptoms per day, we've seen a substantial decline in our ambulance runs for COVID-19 symptom patients coming to our emergency rooms. Next slide. And as a result of that, we're seeing a decline in our hospital admissions for persons with COVID-19. You can look at when we first started April the 8th, look how high our hospital admissions were in our intensive care units, in our intensive ICUs, and we've just continued to see this positive trend downward as a result of all of our community efforts, healthcare system partners working and making a difference. One factor that we always are very concerned about is what percentage of your population is positive? And so the higher the number of people, your percent of individuals who are positive, it implies that you're at a higher risk for more transmission of disease in your community. And as we have seen over time, we really peaked in that last week of April in terms of a significant number of people in our communities being positive. But as you can also see, we have gradually declined since that time in the last 2 weeks. One of the good news and what's been so effective has been our ability to now have our community members have access to our COVID-19 tests. You know, initially it was only available in hospital settings or emergency rooms, but because of our tremendous number of partners that have been out there who've helped us, and we've increased our sites for testing, has made a big difference getting into those pockets of vulnerable populations who always did not have access to the tests. So I'm delighted to say that has been making a huge difference for us, based, as you can tell, on this map. And when we do a better job, in a sense, where we've learned a lot as it's gone along with this COVID-19 disease, that we have, as a result, we have seen a substantial decline in our deaths, along with the decreased hospitalizations, the decreased emergency rooms, and the decreased number of people who are positive for this test. So, Mayor Hogsett, when we look at our hospital systems and our capacity to handle this, we are now at 91 occupancy. But as I have said earlier, a number of these beds now are being occupied by elective hospital admissions. So we still have sufficient capacity if we should see a second surge of COVID-19 that occurs this summer. We are well equipped in order to handle the surge if it occurred during the summer before our influenza season starts. So what's opening now, as the mayor alluded to, our retail stores and malls can open at full capacity with the social distancing. Our salons, our spas, and our tattoos still remain open, but they still need to be by appointment only. And I have to strongly encourage you in this setting, the patrons as well as the employees must wear face coverings. It's really critical related to that sector of the business. But bars, nightclubs, and bar seating in restaurants can now open at 50% capacity with social distancing. Our indoor religious services may now operate at 75% capacity with mandatory face coverings, unless they are outdoors, and outdoor services may be held with no capacity limit as long as it's outdoors. Our public access to government buildings is determined by the entity, but masks are required if you have to come in the city county building, and we strongly encourage it for other facilities. Now, for all of those folks who've been working at home, employees in professional office buildings may return to work at full capacity as determined by each entity, though. And let me give a little caveat related to this. Anyone that's a senior or 60 years and older, or you're immunocompromised, or you have chronic medical illnesses, I would like to encourage you to still, if you have the ability to work from home, telecommute if possible, in terms of being able to reduce your risk. Movie theaters, bowling alleys, similar facilities can now open at 50% capacity with social distancing. Our gyms and fitness centers may now open at 100% capacity as long as social distancing remains, but our locker rooms and shower rooms must remain closed. And of course, we want to have minimized contact if you're doing any sports activities to the extent possible. But our tennis courts, basketball courts, sports fields, and any similar facilities may open following the CDC guidelines. And our pools, you can get wet, but can only be open at 50% capacity. And we don't mind recreational games as long as it's primarily non-contact sports only. So our daycare facilities, our summer day camps, our YMCA programs, and adult day service programs can open with social distancing. Sorry, can I go back? Okay. Campgrounds may open, but any on-site playground facilities must remain closed. And then raceways may open with limited spectators. Any amusement parks, water parks, and any large event venues can now open at 50% capacity. So our large events such as conventions, sports events, fairs, festivals, and parades will be reopened in future phases. Also, our K-12 schools and playgrounds must remain closed at this time. Although if you have any daycare facility that's within a school, they are encouraged to open right now. And our recreational youth contact sports will be allowed only in future phases. So what's going to make you happy? It's only if you're wearing a face covering in public, you're frequently hand washing, you're maintaining 6 feet between yourself and others, and you're strongly encouraging others to follow those same mandates, you're going to be a happy camper, okay? Because you're going to be able to do a lot of things that you weren't able to do at the start of this COVID-19 by knowing that you can remain healthy and do all those things that you want to do as long as you follow our safe, healthy personal hygiene practices. So public gatherings, we are increasing that, but we are limiting it to 250 people or fewer. But again, high-risk individuals, those over the age of 65, some of you can meet that mandate over the age of 60, are encouraged to stay home. And remote working for workers who can do so, we always strongly encourage that and recommend it. So without further ado, Mayor, I just want to thank everybody on your staff and your team and all of the community organizations, the companies, and our governmental agencies and my employees who are out there every day providing resources to the very folks who are vulnerable and need those resources. I just have to continue to commend you. The wonderful support from our community in terms of helping others has just been tremendous, Mayor. And I think it's a great compliment to the city of Indianapolis, the collaboration, the warm hearts from everybody, and people going out of their way to help others. It's just a great city environment. So thank you again for your leadership, Mayor Hogsett.
Thank you, Dr. Caine.
As always, if you will put your name and news outlet into the Q&A box, we will call on you and unmute your microphone in the order with which you've submitted a question. Our first question is from Russ McQuaid at Fox 59.
And good afternoon, Mayor and Dr. Caine. I hate to ask two questions at once, Mayor, but I think I have to do it now. You indicated in your statement that stage 4 begins June 19th. I believe I just heard Dr. Caine run through a list of looking at her screen where she said opening now. So I'm trying to make sure.
Can I answer that? That was just for the daycares that had already been open in phase 3. But everything else, I'm sorry, June 19th.
Okay. And then my real question, I wanted to thank you, Dr. Caine. My real question is, Dr. Caine, do you have any concerns about the increase in the number of new infections we may see in Marion County as a result of all the recent mass protests?
So, Russ, that's a very good question. And of course, we always have to be cautious of this because when you have folks who are protesting, a lot of times they may be shouting or yelling or singing. And so sometimes you can have a higher risk of respiratory droplets that may occur in the air. But on the other side of the coin, it's outdoors. And so because it's outdoors and a lot of the wind and everything, we're hoping that will counteract what we're seeing for those individuals who may not have been wearing a face covering in terms of when they have been walking. But we are monitoring the situation very carefully, and we should know definitely probably within a week or 10 days whether we're seeing any negative impact or increase in cases related to those individuals who participated in the protests. But I also want to encourage anyone who might have a concern related to the protesting and the fact that they may have had someone transmit COVID-19. Anyone can come to any of our testing sites and get tested. We have a testing site in front of our Marion County Public Health Department, so you can call us, and free testing is available for anyone who participated in protesting. But we're very, very hopeful to have any negative increase in cases related to the protests.
Eric Berman, WIBC.
Hello, Mr. Mayor.
Yeah, Eric.
Couple of related questions. Obviously, this is a week behind the rest of the state. What's the rationale for giving this another week as we have before? And does this mean that you anticipate the final stage on July 11th rather than on the 4th of July, or not necessarily?
Yeah, I'll take the first question. We remain a week behind, and the reason for making the announcement today in our communications with businesses throughout Indianapolis and Marion County, a common concern has been in previous movement from phase 1 or stage 1 to 2 to 3. We have made those announcements, generally speaking, 2 or 3 days before the actual stage has been made effective or implemented. And frankly, Eric, a lot of businesses said, rightfully say, we'd like as much time to make the adjustments and going to be permitting as much time as we can possibly be given. So Dr. Caine made recommendations regarding Marion County's ability to now move into stage 4. And so we're making the announcement today, even though stage 4 permission won't be effective until a week from tomorrow, so that businesses who need to rearrange seating capacities and the like can get those adjustments, have an entire week so that they're ready and for greater customers and greater service when the time comes next Friday. So that's question 1. Question 2, Eric, yes, I mean, if you do the calculations and if you stay in the stages as has been recommended by state guidance, we would be at least scheduled or theoretically scheduled to move into stage or phase 5 at some point in the middle part of July. But because, as Dr. Caine has emphasized time and again, we are driven by the data. We're driven by the science surrounding this pandemic as we know it. And obviously, my participation in these decisions is driven by Dr. Caine and her incredibly competent professional health, public health staff. So whether we are in a position to move to the next phase by the 11th of July will be driven by the data. If the data remain good, perhaps we will be able to move that date up a bit. But I rely on Dr. Caine and her professional judgment in all of those regards.
So one additional factor that we looked at is that by that time we will have gotten some significant information in terms of if we've had any impact from the protesters, and so that was just an additional abundance of caution for us, so that we feel really comfortable moving on that June the 19th date.
Jill Sheridan, WFYI.
Hear me?
Yes, Michelle.
Hi, Jill. Mayor, can you comment on the HUD money, the $7 million was announced today, and how you would most like to see, that award spent? I know the city's done quite a bit with the homeless population.
Good question, and I'll throw that to either Paul or Thomas for specific comment.
Yeah, Paul, do you want to take that?
Yeah, I was just generally speaking, so the extra money is going to be utilized for us to continue some of the programs we've already put in place to be able to assist our homeless neighbors in both housing, healthcare issues, and food access. And so it's just really an extra addition to what we're already doing, and just highlights how Indianapolis is continuing to move in the right direction when it comes to helping our homeless neighbors.
Tyler Fenwick, Indianapolis Recorder.
Hi, Dr. Caine. How would contact tracing work for people who test positive after going to protest? Is that something you can even effectively do?
It's a little difficult, but sometimes it just depends on, a lot of times when people protest, they sometimes go with their friends, or they may be an organization that attends, and so if someone is positive, what happens is I can probably interview them and get their closest contacts related to that, and we can do a significant amount of contact tracing if they are local residents. Where it gets more dicey is if they're from out of state or they're from another town. But you would have to encourage everybody that if you participated, and we know this particular person might have just participated on this particular date, we can say that if you were protesting on that particular date and we found some individuals who were positive, we'd encourage you to go and get screened and tested for COVID-19. But it does make it more difficult, yes, for contact tracing.
And Dr. Caine, I'd like to add, and for the mayor as well, on Monday, the City County Council approved, with the mayor's leadership, a significant amount of money to help augment and improve the quality of contact tracing here in Marion County. And so we have a lot of resources being leveraged to make that really successful, in addition to the current success we're seeing right now with Dr. Caine and her team.
Yeah, Paul, was it 20 million?
Yes, sir.
Dylan Pierce McCoy, Chalkbeat.
Hi, can you hear me?
Yes, Dylan.
Thank you. I was just wondering, will Marion County have a unified reopening plan for all of its charter schools and districts? Do you know whether schools will be able to reopen on time and when more details will be available? And then my follow-up question is whether any money will be available or what you're due to make sure that schools can afford the extra costs associated with taking health precautions.
Well, Dr. Caine and I have had many conversations. Of course, the charter schools in Marion County are operated out of our Office of Education Innovation here in the City County building. I can tell you without question, no definitive decisions have been made as it relates to the charter schools. Again, we're going to follow the data and obviously be as careful as is predictably and reasonably possible. Dr. Caine and I have had several conversations with public school superintendents, and they are understandably anxious to be given a green light, not so much because they're worried about not being ready on whatever day they are currently scheduled to open, but rather their concerns are very real in the sense of there's just a lot of planning that needs to be done before opening day comes. And so Dr. Caine and I continue to meet or to virtually meet with the public school superintendents on nearly a weekly basis. And obviously, as the data suggests, we will convey at least the Marion County perspective to those Marion County schools as soon as it is reasonably possible. But I'd like Dr. Caine to also weigh in on that question as well, since we haven't always been together when we've talked to these superintendents.
So I'm very optimistic, but understandably, we're not yet at the point that we have enough evidence that I can say definitively a school will be able to be started in the fall or even in the month of August. We're hoping if the trend continues to go the direction that it's going, that at least by July the 15th, we may be able to have a definitive answer based on our trend. But like the mayor is saying, we're having constant dialogues, usually on a weekly basis, sometimes twice a week, with the public systems. And we have also been meeting with the archdiocese school systems, and eventually we want to be able to talk to all the private schools that are out there and other charter schools related to this effort. But just trying to work on, if we do, we're reopening the schools, having the plans in place from all the school systems, what needs to be done. We don't want to wait till we get to that point. So that's what we're aggressively trying to work on right now in the next couple of weeks. And each school's a little bit different, so one plan doesn't fit all. So trying to really flesh out those complexities in terms of safeguarding our children.
Yeah, and I'd just simply add, I'm sure you probably appreciate this, at least among the public school corporations, I think that the first day that the earliest that any of the public school corporations are currently scheduled to open, I believe, is July, I want to say 29. Many public schools open the first week of August, but July 29, I think, is the very earliest date of the current schedules permit. Paul, do you want to respond to the question of if any monies would be available to assist public school corporations in whatever adjustments and protections and precautions that they need to be taking?
Yeah, sure, sir. Thank you. So, we're working, as the mayor and Dr. Caine said, with the school corporations to determine what a plan and program looks like. And then, we are going to go back and look at the CARES Act funding to really see what is allowable with that. And if there is a way to assist the school corporations, we'll surely explore that opportunity to see what we can work out. But at this moment, nothing is concrete in terms of what we can set aside and what we can't.
Right.
Ross Dodge, WITT.
Afternoon. Marion County Fair is scheduled to begin on July 4th. I'm hearing the thread of the conversations today that it's entirely possible that Marion County won't enter phase 5 until July 11th. Would that require Marion County Fair to move their date or cancel it, or would there an exception be made for that?
Well, I don't think, and Dr. Caine, correct me if I'm wrong, I don't think any fairs or festivals are permitted until phase 5. Is that correct?
Yes, that's correct.
Yeah, so in answer to your question, Russ, we obviously will be driven by data as to when we can make that move. I will be completely candid with you. I've had no communication with any of the board of directors for the Marion County Fair. I don't know whether you have, Doctor.
No, I have not.
Okay. And so, obviously with this now being almost mid-June and with that fair scheduled to begin in July, maybe that's a conversation that we can make a priority conversation to have. So, Thomas, has to your knowledge, has anyone contacted us about the Marion County Fair?
I genuinely don't know, but I'm sure we can find out, sir.
Okay. All right.
Thank you all for joining us for today's media availability. We'll have a copy of Dr. Caine's presentation as well as further information about today's announcement in your inboxes momentarily. Thanks so much.